Hey everyone! Today I want to talk about something really important and often overlooked, the surprising link between mental and physical health. Let's dive right in. First up, let's talk about physiological pathways. Chronic stress and hormonal imbalances can really mess with your body. Prolonged stress from anxiety or depression ramps up your cortisol levels. This can lead to inflammation, hypertension, and even metabolic disorders. It's a domino effect that increases risks for cardiovascular diseases, diabetes, and immune dysfunction. And speaking of the immune system, guess what? Chronic stress and depression can weaken it, leaving you more susceptible to infections and slowing down your recovery time. Then there's the gut-brain axis dysregulation. Anxiety and stress can wreak havoc on your gut, making conditions like IBS or ulcers even worse. And let's not forget about pain perception. Mental health issues like depression can amplify chronic pain, creating a vicious cycle where pain and mental distress feed off each other. Now, let's move on to behavioral impacts. Sleep disturbances from mental health disorders like insomnia or hypersomnia can impair your immune function, cognitive performance, and overall recovery. This increases the risks for obesity and cardiovascular issues. Depression and anxiety can also mess with your appetite, leading to either undereating or overeating, both of which can raise risks for metabolic syndromes and diabetes. And guess what? Depression can suck the motivation right out of you, leading to a more sedentary lifestyle. This can contribute to muscle atrophy, weight gain, and cardiovascular decline. Plus, to cope, some might turn to substance abuse, which brings a whole new set of physical health risks like liver disease, respiratory issues, and cancer. Lastly, let's talk about healthcare-related factors. Mental health struggles can lead to neglecting self-care, poor hygiene, missed medical appointments, or not sticking to medications. All these factors can worsen chronic conditions like diabetes and hypertension. And psychiatric drugs? They can cause side effects like weight gain, metabolic changes, or movement disorders, indirectly affecting your physical health. Stigma and cognitive impairments can also delay diagnosis and treatment of physical ailments, making things worse. In the long run, chronic anxiety and depression are linked to hypertension, arrhythmias, and heart disease, even after accounting for lifestyle factors. Severe mental illnesses like schizophrenia and bipolar disorder can even reduce life expectancy due to preventable physical conditions. Shared biological mechanisms like chronic inflammation connect mental health disorders to conditions such as arthritis and autoimmune diseases. So what's the takeaway? Mental health issues profoundly impact physical health through interconnected biological, behavioral, and systemic pathways. Addressing mental health holistically is crucial for improving overall wellness. Intervention should integrate both physical and mental health care to break the cycle of mutual deterioration. That's it for today, folks. Take care of your mind and body. They're more connected than you think. If you found this helpful, don't forget to like, subscribe, and share this video. Until next time, stay healthy.